an agenda out. Some of the things we want to talk about, obviously, today. What can we do to better share resources or information between our governments on COVID-19? Obviously, the main objective, how else can we support our frontline workers facing COVID-19 every day, including our emergency management staff, healthcare workers, and our first responders. Obviously, each of us know our communities are hurting in many different ways right now. What else can we do to support our citizens? And once this crisis passes, we know we're going to have to work together to build back our regional economy. So what can we do to help with that? When I helped put this agenda together, there was a number of different people I spoke to, and I want to thank each of them. Obviously, our county administration, which works very closely with your counties and cities, the Pasco EDC, Tampa Bay Partnership was involved in this, our hospital CEOs, which I had a meeting with yesterday, Public Works, and a number of other people that had input on some of these questions and items for the agenda. What I'd like to do, if we could, I just kind of start off with the agenda at hand. Please feel free to jump in at any time. Obviously, an open discussion, anything we can do to share our ideas is positive. So we'll just go ahead and start with mobilizing resources on a regional scale. And the first thing on the agenda is testing sites and the ability to coordinate sites, capacity, and prioritize these for the residents. I know we're getting test kits in now. Just for the record, Pasco got 300 on Saturday. If anybody would like to talk about what kits they have between Hillsborough counties and Pinellas counties and the cities, I'd open that up, please.
Hillsborough County received 1,000 on Saturday, but I believe we were able to get another 100 or so, I think yesterday. And we're going to open up the testing site in Raymond James Stadium, I believe, tomorrow.
Okay, great. And Mr. Chair, do you have any other off-site or drive-up testing sites in Hillsborough County at this time, or is Raymond James the only one that you're aware of?
Well, Raymond James is the only one that we have that people can make an appointment to go with the test. I think some of the hospitals are doing their own. I think the mayor's been working with some of those CEOs, Mayor Castor. Some of those CEOs, she might be able to address that much more thorough than I can. Mayor?
Yeah, yes, Baycare has 7 sites, and they are not all up and running. It's all dependent on the supplies that they have, but they were running 7 sites as of, I think, a week and a half. All these days have just melded together about a week and a half ago. And then TGH is doing a smaller number of tests. And Advent, they didn't necessarily have the capability in the beginning, but they're trying to ramp up testing as well.
Thank you, Mayor. Pinellas County?
I don't know. Is Lourdes on here?
Yeah, Commissioner, I know they asked for us not to participate, but I will say that our Department of Health does have a couple of sites open, as does Baycare, and pretty much the same as Mayor Castor said. It's not 100%, right? It's day by day.
Yeah, no,
and
I
we have not received test kits.
Okay, good. Well, Mayor Hibbard, do you anything different going on in the city of Clearwater? Or are you just working together?
The Baycare site that I'm aware of is the Carillon site. So we do not have it at the Morton plant site currently.
Okay. And now with the rapid testing coming out, and my thought was, and please chime in, is that, as a region, we're going to continue to need more testing kits and obviously PPEs. I know Jerry Markowitz and his team are doing an excellent job in the state of getting those out as quickly as possible. We really appreciate all their efforts from the state. At the same time, I'm wondering, and would love to hear your thoughts, if we could talk to the federal government, including FEMA and the CDC, to encourage them to continue sending more PPEs and testing kits to the Tampa Bay region. And my thought was if we would want to get together on that. I think sometimes, obviously it's beneficial to work in numbers and as a region. Sorry, I'm just getting a little background noise. Okay. Love to hear your input on, again, working together as a region to speak to the officials in the CDC and FEMA to encourage them to continue to send more PPE and testing kits to the area. Any inputs appreciated.
This is Mayor Castor. It's not really the testing kits. We have plenty of testing kits.
Okay.
It's the collection kits, the swabs, and
Okay.
that's where we're having an issue. USF Medical, they've been printing them through a 3D printer, but they don't have FDA approval yet, so they can only use them at USF affiliated hospitals, Tampa General, which still is a relief because then, we would be able to get theirs. But really, this is a problem that's nationwide. Like a U.S. Conference of Mayors, we talk on a regular basis, and there's just a lack of the testing swabs and the PPE nationwide. And we can go at it as a region, and there's always strength in numbers. But really, I've found that Jared Moskowitz is the emergency manager for the state, and really just daily calls to him to make sure that we're getting our share, our percentage. But again, that is going to be small. And I'll tell you too that a lot of areas are pivoting from the testing because we've missed that window to testing for COVID, to testing for antibodies, basically to find out the number of people that have already had this and have been able to go through it without really even knowing that they have it. And then those individuals can basically go back to work because they have an immunity and can also be used to care for those in the high risk categories, those in the nursing homes or the health professionals in the hospitals. And so that really is ordering those antibody tests, which is a blood test, to see that you have you've already had it and gone through it.
Great. Thank you so much, Mayor. You're right. Yes, that's the shortage of the swabs, i.e. Collection kits, is something we got to continue to, obviously be concerned about. I know the rapid testing is going to be pushed out here soon. I mean, that could be very beneficial, especially talking to our hospital CEOs, the amount of time it's taking people when they're convalescing in the hospitals because they don't know if they're positive or not. I'm ecstatic for that. Hopefully, those will get pushed out on a rapid basis. I don't know if anybody else is hearing anything about that. I would love your input. No. Okay. Well, let's move on then. So, isolation centers. One of the things I've talked about with the hospitals and also our EM director, our isolation centers. If unfortunately we get to the point where the hospitals are become overwhelmed, obviously they're going to need sites for folks. Here in Pasco County, confirmed again with our emergency management director this morning that we do have 2 sites here in Pasco County secured. I can only assume that Hillsborough and Pinellas has done the same. But just the thought is obviously if we need to work together, if one county gets overloaded at these sites, obviously possibly we may need to allow patients to move back and forth, traverse back and forth across counties. I'd love to hear anybody's input or thoughts or suggestions. Anybody like to speak?
Probably be more This is Mayor Castor. I think it'd probably be more beneficial just to make sure that that you would have that overflow capacity in your particular area. I think it'd be difficult to transport individuals across. I know our hospital CEOs, our major ones are Tampa General, Baycare, and Advent, and talking with the CEOs from those hospitals, they're looking at different options. One is we have 8 cruise ships that are here. They still have all of their crew on them because they can't get back home. And so that's one of the options one of the hospitals is looking at. And then I know yesterday the county commissioner, Mike Merrill, said that they had secured 2 hotels that could be utilized for patient overflow and or could be used for housing health professionals that didn't want to go home and possibly infect their families, and same thing for first responders. And then there was some talk about the Yingling Center out at USF gymnasium being used as well, but the hospital CEOs weren't aware of that. So anyway, I think it's probably best, just my personal opinion, to try to figure it out on a county by county basis, because transporting people back and forth, it's probably just going to move too fast to be able to do that or have the transport available.
Okay, thank you, Mayor. Anybody else want to speak to that? Hillsborough County, Pinellas County?
Last Miller, I think the mayor hit it on the head. That's going to be awfully difficult to be transporting between counties and counties. I don't see how that's going to work, and I do believe probably our health departments would be totally against doing something like that.
Okay. How about Pinellas County? Have you guys been able to secure any sites at this time?
Yeah, and I also agree, this is Lourdes Benedict, with what has been said as far as transporting county to county. We are working with our hospitals and getting ready for the surge. They are all wanting the folks with COVID isolated in the hospitals and move others out as needed. We also have a hotel that we have secured for those who have nowhere else to go and test positive or pending results.
Thank you so much. Anybody else? Anything else on this subject? Okay, seeing none, I will move on. So I think that really kind of hit the hospital capacity too. If anybody else has anything like to add to when it comes to hospital capacity, I know the conversations I had yesterday with the CEOs in our county, they're down probably their census is probably down around 30 or plus % compared to last year's time. I would assume you're hearing probably the same thing. Obviously, a lot of that's due to not having the elective surgeries. There's not as many people coming into the ER. Now, if we do have a surge, obviously that down census can be beneficial. I don't know love to hear what you're hearing in your areas if it's the same.
This is Mayor Kessler. Our hospitals are rising. They had the downturn because of the cancellation of elective surgery and just basically getting as many people out of the hospital as they possibly could. But ours are trending up, not dramatically at this point. But our density is so much. It kind of puts us in a different category because of the density and the ease with which it's transmitted.
Okay. So just to recap that, Mayor, you're stating that you're hearing that the census is actually up in your hospitals. Yes.
Now I haven't heard directly from Advent, but
okay.
From Baycare and TGH.
Okay. So there lies a difference between the counties we're seeing right now. How about Pinellas County? What are you hearing there?
Pinellas County actually is the opposite of what was just reported. We're at about a 34% capacity. What we are seeing an increase are folks coming into the ED regarding respiratory issues. That volume has gone up slightly a couple of days ago, but it's standing the same as of yesterday. We're having calls daily with the hospitals.
Okay. Thank you all. Anybody else like to add anything to this? Again, I think it's important to obviously know what's going on in the region when it comes to especially the census and capacity in this hospital. So I know our county administrators will continue to share that information with each other. We appreciate that. Staffing, call I had yesterday with, again, the hospital CEOs, obviously concerned about staffing. They were stating that they were even pulling from some of their home health companies now.
Remain on the line.
Sorry, we're getting a little background from somebody. They were pulling from home health teams and some of their ambulatory centers to make sure they had proper staffing for the future. Staffing companies that provide, travel nurses and stuff are being spread thin from my understanding now. So that's one thing, obviously, we need to continue to think about, and anything we can do to support our hospitals in that manner would obviously be positive. Supply chain, if we can move on to that, that's okay. Work with the EDOs in our region to coordinate with manufacturers.
Please remain on.
Working with our EDOs again in the region to coordinate with manufacturers. Like for example, here we have Touch Point Medical, which is a manufacturer. We know one of the breweries here in Pasco County is in the process of making hand sanitizers. We've talked to companies that are making masks and gowns, and as I think it was Mayor Castor or mentioned a little while ago about USF using 3D printers. We even have a couple of high schoolers that were using them here in Pasco County to make masks. Any input, anything we can continue to suggest to make supply chains flow smoothly, especially if we have a shortage in one area. So if we have a shortage in, say, Pinellas County,
Please remain on.
If we have a shortage in Pasco County, obviously we'd want to be able to, if there's any excess supplies in another area, we would want to be able to work together to, and then likewise for another county. So I'd love to hear about what you're hearing in your area when it comes to manufacturing. If you have manufacturers that have obviously switched over to making some of these necessary items.
This is Pinellas. I'll report out on that. We actually are working through our economic development as well and have several manufacturers in the local area.
We'll begin shortly. Please remain on the line.
That are producing.
I'm sorry, let me just put you on hold real quick. And I apologize. I mean, there seems to be one caller that maybe their phone line is open, and we're getting some feedback from that. So maybe if we could just check our lines or check our phones, I appreciate it. And I apologize. Please continue, Pinellas.
Sure. So we have manufacturers that are working on face shields for us. Actually, going to be going into production this afternoon. Been working with them for about 2 weeks now to make sure it's the right equipment, right measurements, and meets all of the guidance that we need. So we have our medical folks looking at that. They're also going to be.
Please remain on the line.
Making gowns, as well as the surgical mask. The biggest gap that we have, which is, across the country, are the N95 masks. But just about everything else is in production.
Great.
So we can definitely share as we hear that some of our other partners are in need.
Great, thank you so much. I think that's what's very important. Again, if we find vendors that are able to produce these necessary PPEs, that we do share those resources, and I'm sure everybody is willing to do it. Hillsborough, you hearing anything going on over there that where they're?
Please remain on the line.
Can we cut that phone off somehow, whoever that is? No? Okay. Hillsborough or Tampa, City of Tampa, would you like to add anything?
There's a number of I'm understanding a number of facilities over here that are working on trying to develop masks through this 3D printing.
Yeah.
We all know USF is doing their very best to get equipment and getting testing equipment on.
I clicked on the webinar link.
I did check your system before I did coaching meeting.
Whoever that is.
Still just going in a circle.
Okay. And I'm sorry, I'm going to put everybody on hold real quick. So,
And open them back up.
caller 2.
Please remain on the line.
Yeah, and it doesn't matter unless you have to read something.
What? The person that's on the screen now? And I'm sorry, whoever's on the screen now. All right, thank you. You cut off. Okay. I need that person to mute their phone. Thank you. I apologize, Mr. Chair.
As I said, we have some companies over here that are doing the very best they can to produce any major equipment they can. We all know that USF is doing its very best, but they're running, and obviously they're running into problems. They're waiting to get a lot of things certified by health people. I don't know of anyone else over here that's making any equipment as fast as they possibly can to get things done. Maybe the mayor knows, but I'm not aware of anything at this point.
Okay. Mayor, anything to add?
We do have a couple breweries that are doing the hand sanitizer, and then a lot of the just group citizens that are making the homemade masks, and USF, in addition to the swabs, is making, as Chairman Miller said, the face shields too.
Okay.
But that's not going to be large quantity.
No, it's not.
No, I know. So again, just encouraging everybody as we move forward with and encouraging our emergency management directors to stay in contact, which I know they are, but we want to encourage them to continue to stay in contact. If there's a shortage of any supplies and we know there's excess in some area, or a vendor that somebody found that has a large supply, just like to encourage us again to share those resources if at all possible. Thank you all. I think that we can move on from the PPE, because we could have covered that just then, unless somebody else has to add to that. I think we covered that twice. If everybody's okay, I'll move on. Blood supply, I just want to bring that up. And I'm sure you've had the same conversations with your hospital CEOs. Right now, they're not, my local ones here, so they're not at a shortage, but they're concerned there could be a shortage in the very near future. Obviously not as many people donating blood at this time. My thought could be, if needed, we could do a unified call in the near future for blood drives. If everybody's on board with that, we may need that. But again, I think if we do a unified call in the region, it could be beneficial. If anybody like to speak to that at all, what they're hearing. Okay. All right, we'll move on. Social services. I know the most recent thing we saw the city of Tampa set up a tent city for the homeless population to service them. I know here in Pasco, Pasco Senior Services are distributing meals via drive-through and delivery, since the congregate dining areas in our county are closed. Would anybody like to add anything that's happening in their counties or cities in reference to social service? And I know, if I'm not correct, Chair Gerard, I mean, near and dear to your heart, because you have obviously a background, if I'm not correct, in social services.
Right. Right. We have a lot going on. And Lourdes could probably tell you much better, but we have feeding stations. We have a whole work group that's working on human services. Lourdes texted me a little bit ago that, can you hear me? I wasn't sure if I muted my line or not. That we have a hotel set up for homeless. Just a number of things going on. There are sites all over the county for kids who are not going to school, for feeding kids who are on free and reduced lunch. I forget, Lourdes, how many work groups do we have working and talking to each other just about every day?
Yeah, we have about 11 different work groups. They consist of faith-based work group, behavioral health, the hospital work group. We have a feeding work group, homeless work group. We have 9 sites at the schools that are feeding. I know a lot of people are doing that. So that seems to be going very well, actually.
Yeah.
Folks are really coming together.
So, Madam Chair, I'd love to hear, can you tell me a little bit more about, you mentioned that you have a hotel that you've secured to help house the homeless?
I just heard about that myself, so Lourdes will have to tell you.
Sure. We are working with one of our local hotels that has 2 different buildings, because of course we don't want people mixed in. So we have one of their buildings is just for our folks. Currently, we only have one individual that we're waiting back for the test results, but we have capacity for 50, and we can ramp up to over 90. So that's what we've got right now, and we're also in the process of building those relationships with other hotels as we are waiting for this to surge. So we want to make sure and be ready. Department of Health is on board with that, and they go out on a daily basis to the one individual we have now, and we'll be ready to do that with others. We
Hey,
have
I'm on a
folks-
conference call. Can I call you right back? Well,
we have folks that are bringing in food and all of that. All of those wraparound services, including crisis counseling, is ready for those folks.
Thank you so much for that. Anybody in Tampa or or Hillsborough County like to add to anything when it comes to social services and how we can possibly again work together? Okay.
This is Mayor Castor. I think just the best practices. We just launched that homeless shelter that can house 100 individuals. And so we're going to give that a few days and see how it works out before we look, to expand that. And I know that Hillsborough County, that their homeless outreach is looking at securing hotel rooms to put some homeless in. But that's one of the things too, that it can't be forced. And there are a lot of individuals that don't want to go because they can't carry on their lifestyle in those locations, which basically means drug and alcohol use. So it's filling up. We didn't put the location out. We didn't make that public.
Okay.
But I think that the homeless communication system is better than any communication system that we've all put together. So we can keep you posted on how that's going.
Okay. Can I ask you a
anyone
question?
having
Also in Hillsborough County, besides the hotels, our staff and social services and affordable housing have been working together and putting together a plan right now as to how we're going to be able to help people, number one, with rent that they have to pay.
Yeah.
Also, any other social services we can help them with. They're on board. In fact, this morning I had a conversation with our director of affordable housing and where we might be with the plan that once we're going to have a lot of people coming in for rent assistance, things like that. We'll be putting together there. Our social services area, we're also working with food distribution folks and trying to make sure that we're able to help them in those type of ways. So besides the hotels, there's work with the homeless, we work with the homeless initiative program, and other social services things that we're putting in place because this thing is going to go on for a while. It looks like we've got to prepare to ramp things up eventually more than we have right at this point in time.
Okay. Thank you, Mr. Chair. I just had a question too. It could be for either Chairman Miller or Mayor Castor. In reference to the shelter Mayor Castor, you mentioned you had in place now. I'm just curious, how is that being staffed?
It's in partnership with Catholic Charities, and there are a number of volunteers there. We also we have basically reassigned all of our city employees that we're tasked with providing services that have been canceled, parks and recreation, those types of things. So we've repurposed all of those individuals. We're using some there. Clearly, law enforcement, not only within the shelter area, but in the neighborhood around to ensure that they're not negatively affected by it. But a lot of volunteers, and we had a lot of services that were provided pro bono from a number of different companies. And I hate to say, but I have to walk into a meeting here at 11. And the one thing before I get off of this, I just want to clarify that our hospitals are not at surge capacity yet. They're just trending up on the presentation of respiratory and ventilator use as well. So it's not to emergency status, but they are trending upward.
Good. Well, Mayor Castor, thank you so much for being on the call, and thank you for sharing. And again, I know you're busy at this time, and I think you've had a city council meeting coming up. So again, thank you so much for participating, and we'll continue to work together.
Thanks. I appreciate it. Y'all take care.
Thank you, Mayor. Okay, so moving on, we discussed this just a little bit, and Chair Miller brought it up too when it comes to housing, but housing and food shortages, I'll just kind of take those together if that's okay. I know one of the great resources to track calls that are coming in when it comes to housing shortages and food shortages is that the website 211counts.org. Again, that's 211counts.org. It's available to monitor and obviously we can continue to ask our social services organizations to keep us updated. I would assume everybody's probably already aware of that, or working with their some of their local providers and not-for-profits when it comes to this. But anybody like to add anything to this subject? Okay. No? Okay. Anybody seeing or hearing about shortages when it comes to food at this time? No. Okay. Let's go to utility loads. As we move into hotter months, with so many people being home, especially our kids now, we could possibly have issues with the grid. I was wondering if it gets to that point, if we could work together again regionally. We may need to do a PSA out there, possibly about energy usage. We're in contact, obviously, with our utility providers. I have 3 here in Pasco County between Withlacoochee, Duke, and Tico. I don't know if anybody else here has had discussions with any of the utility providers, or if you'd be interested in, again, continue this discussion, and possibly, if we need to, do a regional PSA out there, either radio, TV, papers, things like that, about energy usage to keep it down so we don't overload.
Well, this is Commissioner Miller. I've been in contact with TICO, and they haven't put anything else out yet concerning energy load and what it's going to look like for the upcoming air conditioning season. It's already here. They have not put anything out yet. I don't know if they're going to put anything out. I haven't talked to them since a couple of days ago. One of the things they did notify us is that they're going to be going before the Public Service Commission in June to ask for a decrease in rates, which is going to help out a lot here if they get that done by the PSC. As far as putting anything out concerning how to utilize how to cut back on your utility wattage usage, I haven't heard anything from TICO on that issue yet.
Chair Miller, is TICO your only provider across Hillsborough County, or does Duke or anybody else come in too?
No, TICO is the only provider. Duke may have a small portion of west Hillsborough County, but it will be very, very, very small.
Okay. Pinellas or Mayor Hibbard, anybody?
We're Duke, so exclusively. I have not heard yet. I literally, unfortunately, got sworn in yesterday morning, so I'm still catching up.
I know we're throwing all this at you today, sir, but again, welcome and congratulations again on your election. So
thank you.
Solid waste collection and disposal, having conversations with our solid waste department, which I do know they communicate amongst each other. Just one of the concerns when it comes to public health and safety is with, again, so many people being home, working from home, kids at home, we're going to start obviously possibly seeing the amount of solid waste increase dramatically. One of the concerns I talked to with our folks in a hauler was possibly not having enough staff. Last thing we want to see anywhere is trash sitting on the side of the roads causing health issues. Just wanted to keep it open and keep this dialogue open. If there's ever a time we need to assist each other within the counties or cities when it comes to capacity, if we could keep that dialogue open. Hopefully, again, it doesn't come to that, but I think one of the things we need to continue to do is be prepared and not be caught off guard. Anybody like to add to that or speak on that or what they've heard? Okay. Well,
I'm not sure that's one of the many things we're talking about yet.
Okay.
But
Great. That's here. And again, we'll just continue to encourage our solid waste directors to communicate with each other. Obviously, we can learn from each other, and if something goes down in one county, we can learn from that. Hopefully, again, it doesn't come to that. School closures. This is just a thought. Obviously, I know we have separately in Pasco County. We have a separately elected elected superintendent as well as the school board, where you both have, if I'm not correct, elected school boards and appointed superintendents, but the communication, needs to remain open, I think, between obviously the county and city leaders with our superintendents and school boards. Personally, I think I know that got extended yesterday till the end of April. I have 3 kids myself, and a wife that's a registered nurse that works for the school system. So this is going to be an interesting time for sure. But my thought was, and talking to some others, if we could continue or actually encourage our school boards and superintendents to communicate, which I know they are, but I think it'd be beneficial if and when, and hopefully it happens, they can reopen, is that we actually do our best to open back up simultaneously. And I say that because we have so many employees that are crossing over between the different counties and cities that are working. And it would just cause, I think, an unneeded hardship if we open possibly up at different times. I'd love to hear everybody's input or thoughts on that. Anybody like to add to that, or is in agreement of that?
Makes perfect sense. We have a lot of workers that live in your county. I know that.
Mm-hmm. So would you agree that it'd probably be beneficial if they do open schools back up, that we do our best to encourage that they open at the same time, same days?
It makes common sense,
yes.
but
yeah. Okay. Great. Anybody else like to add to that? No? Okay, well, let's move on to law enforcement a little bit. Having a conversation with our sheriff, Chris Nacco. Law enforcement in this area has a Tampa Bay Regional Information Center. It's run out of, if I'm not correct, the Hillsborough County Sheriff's Office. And Chair Miller, you could probably speak to this. The share information, intelligence, driving policy, and it also has federal and state, as well as local law enforcement, fire departments, TIA, Port of Tampa Bay are all involved. I just want to encourage every city. I know if I'm not correct, the counties already are, maybe not, but to be involved with this, because in a time like this, we're going to make sure that they're able to coordinate together and share this information amongst each other.
Well, I know in Hillsborough County, we communicate very well with the city of Tampa, Class City, and Temple Terrace with our sheriff's department. I don't know how that is working between counties with the communications. I would hope that there is some type of communications there, but I'm not quite sure how it's working outside of Hillsborough County. Your county or Pinellas County, I'm not quite sure if that's working or not. But we do have a constant communication with our law enforcement. The reason being probably because in Hillsborough County, we're a little different from everybody else. We have an emergency policy group that consists of the county commissioners, all 3 mayors, the sheriff, school board chair, and we've been meeting twice a week now for every day. Those days for about 2 or 3 hours, and that communication goes throughout the system of Hillsborough County. So I don't know what's happening outside of Hillsborough County, but I imagine there's some kind of communication going on. I mean, yesterday there obviously was a communication between Hillsborough County and Hernando County when there was an arrest made.
Yes, sir.
So somebody's talking to someone.
Yes, sir. Thank you, Chairman Miller. Anybody from Pinellas, City of Clearwater?
I think we've had a great coordinated effort with the sheriff. There's been daily communication over here. That is a call I've been on for 2 weeks. I think Chair Gerard's done a great job of coordinating between, our 24 cities and the county.
Yes, you do have a lot of cities.
Yes.
Great. Okay, if there's nothing else on that, I just want to, again, we can encourage everybody to be a part of that. That'd be excellent. Let's move on to, looking towards the future. When it comes to economic support and recovery, we will come out of this. The question is when we're going to come out of this, but we all want to be prepared. Having conversations with my economic development team, Tampa Bay Partnership. I think everybody's in agreement that we need unified messaging from our regional EDOs and a coordinated message from all of them on with both employers and employees. I'd love to hear everybody speak to that or on that subject. I think we could all agree, though, we want that. It would be nice to have that unified messaging with our regional EDOs. If we could just continue to encourage them to work together, which I know they are, but encourage them to work together, not just now, but when we, during the recovery process. Okay, we're moving on.
Well, I've already talked to our chamber, and we're starting a business task force. This is Frank Hibbard. We are already putting together a task force for recovery, and we're just trying to get different people from different industries. We've also called upon our Washington lobbyist, who's got a fairly good handle on the bill that was passed in Congress. I just want to be the clearinghouse for helping all of our businesses, and I don't think it should necessarily be a Clearwater thing, but a regional thing. I just think a lot of the businesses don't understand the intricacies of the process. We were talking about giving forgiveness, for instance, to a lot of our commercial renters in the marina that we have, and what we've determined is it would be better for them to go with the SBA loans, pay their rents, and then those will be forgiven. And I think it's the mechanics of all this is difficult, but I already want to get the message out that we're preparing the soil to be fertile once people can go back to work.
Great points, Mayor. We really appreciate that. Anybody else like to add from Pinellas or Hillsborough County?
Well, I think our economic development department is doing the same. I mean, trying to facilitate the loans, but of course they're overwhelmed with that, with businesses trying to get them.
Yes.
So
I saw that. I think maybe it was City of Tampa, or it could have been Hillsborough County, but I think City of Tampa did one too, a call with businesses. I'm doing one tomorrow with our EDC, and then obviously Eileen Rodriguez, which I think you all know from the Florida SBDC. I'm doing a call tomorrow for our local businesses to be able to call in and talk about, obviously the bridge loan and the federal disaster loan, obviously to get that information and help them through that process. And some of those applications can be a little overwhelming for folks, especially, some of our small businesses that are trying to stay open. But time is of the essence, because some of that money obviously could run out.
Mr. Chairman, this is Commissioner Miller. I've got a call coming in from our transit executive director I got to take. I apologize. But if anything else you all can do, we're going to have another conference call. That'll be fine. Just let me know.
All right. Thank you so much, Chair. Appreciate it. Yeah, we're going to wrap up here too. Anyways, just a couple more things if we could. This one was very important. And I don't know, does anybody sit on the Tampa Bay Regional Planning Council? I do not. One of my fellow commissioners does, but Chair Gerard, do you sit on the Tampa Bay Regional Planning Council?
no, I don't. No.
Okay. Well, so there's regional grant opportunities through the EDA, which I think would be great for the Tampa Bay Regional Planning Council to take the lead on. Since they're obviously they're designated as the economic development district by the U.S. Economic Development Administration, and working with them could be a key to unlocking these federal grants for the region. Obviously, it's important for recovery, and we could use their data and analysis capabilities during this time. Each one of us participate with the Regional Planning Council and pay into the Regional Planning Council. So I would like to encourage everyone, and if you can encourage whoever or the county administrators are on the line or city managers on the line, encourage your Regional Planning Council representative to work with the Regional Planning Council to push for these grants on a regional scale, because we have a much better chance of getting these grants. And the EDA always prioritizes regional grant applications over local grant applications. I think we got the EDA received $1.5 billion in supplemental funds in the CARES Act. So that's going to be up for grabs.
Well, I will certainly let somebody know.
Yeah. And I think we'll reach out to, I know our county administrator is reaching out to the Tampa Bay Regional Planning Council. We'll give this information to our representative, but now is the time for us to do it. We don't want to get behind the curve, but again, thinking about regionally, we're going to have a much better chance. There's also the regional CDBG grant opportunities via the CARES Act, which could address housing issues. CDBG is going to receive $5 billion in supplemental funding, and $2 billion is going to be distributed, I think, in 2020 within possibly, let me see, according to the 2020 allocation, within 30 days. So that's something else we can encourage our regional planning council to take the lead on, since they do represent all three of our counties and the cities that are within those counties. And I know we had to lose a couple people because we are getting close to the time. I'm just going to move on and skip over to the employment centers and utilizing career sources on a regional level. Again, when we talk about especially the recovery phase, we want to try to help our people get back to work as soon as possible. I think it would be important to encourage Career Source, Pasco, Hernando, Pinellas to be able to access all the jobs throughout the counties in the regions, not just the ones within that county. Because again, we know people cross over. They may not have the same job they had before, but at the same time, we want to make sure that these people are back to work, whether they're working in our county or one of the other counties or other cities. I don't know how, I would assume everybody works pretty close with Career Source or whoever their employment agency is in the area.
Well, I do. I'm on our Career Source board, and right now I think they're just trying to deal with unemployment claims. But I will suggest that they have regional job fairs when they get back up and running.
Oh, thank you so much for that. Yeah, thank you for that. Last thing, and I'll just open it up to anything else you want to add. Regional Resiliency Assessment Program. That's from Homeland Security. I just wanted to bring that up to everybody. It's a way to help improve and harden critical infrastructure. And it could build upon a recent study of the Tampa Bay Resiliency Coalition. It was actually presented to all the MPOs. So there's possible federal grants available there, which again, if we do it on a regional level, we have a much better chance of getting those. So if we could work with your teams and talk to your county administrators or city managers to work together on that, that actually could possibly still be something for the regional planning council to take on. So,
right.
Yeah. One thing I want to throw out there too is just it's not on the agenda was tourism. I got off the phone this morning with our tourism director. Again, my conversation was everybody's getting good, obviously hit by this. In Pinellas County, I know with your beaches, tourism is just huge for you guys. And so many people are hurting because of this in that industry, whether it be, whatever service industry they're in or the hotels, et cetera. But I was encouraging our tourism director to work together with the other DMOs in the other counties and the cities. And he did say they already were. And the thought being, when we come out of this, we're going to be lagging obviously on TDT dollars, every one of us. And this will be the perfect time for us to work together regionally to put out messaging. Obviously, when somebody comes to, Pasco County, there's a good chance they're going to go to Hillsborough County and possibly go to Busch Gardens or go to a beach in Clearwater. But when it comes to employment, we have a lot of citizens that are going to depend on the tourism industry bouncing back really quickly. So any thoughts on the tourism I would love to hear about?
I think it's all about the timing. Obviously, we want to make sure we, lose as few as we possibly can. But even some of our well-established hotels are bleeding,
Yes.
mightily depending on their leverage right now. I've talked to several of the owners, and I mean, some of them are enormous, like Opal Properties. So it's going to be a challenge.
Yeah.
Yeah. I think again, perfect timing for our DMOs to work together on that regional messaging once we do come out of this. Obviously, being as prepared as possible now, it's the right thing to do. So let me just open it up. And anything else? Anybody else has any other subject matter you would like to talk about? Any thoughts? Any suggestions that we can share with our teams? I'd love to hear.
I mean, the biggest thing for me is I'd just like us to work on finding best practices that we might be able to share back and forth.
Mm-hmm. Okay.
You know, rather than reinventing the wheel.
Right.
You talked about homelessness. We're having a real problem with the homeless not following social distancing,
Mm-hmm.
especially the hardcore homeless, and they have nothing to lose. And I'm afraid of them being a petri dish of, that can be spreading it. So we haven't figured out a solution there, but I'm sure we're all dealing with similar things. If we can find a way to post some best practices, I think that would be great.
Yeah, you're right. Best practices that we can share, whether it be our homeless coalitions or our, social services, continue to work together and share those ideas. Madam Chair, anything you'd like to add or subject matter you'd like to bring up before we retire?
Nope, I don't think so.
No? Okay. Well, listen, I really appreciate everybody getting on the phone today. I just think it's important for us to continue to communicate as a region and share these ideas and figure ways that we can work together. We'll talk to our county administrators and our team, and we continue to communicate together. I would love to get on another call in the very near future as things change, because we know things are going to continue to change, unfortunately, on a daily basis. What's happening today is going to be very different than what's possibly happening tomorrow. At the same time, let's just make sure we all know we're in this together. We're here to help each other. Please feel free to reach out to me anytime. And if I can do anything for you, please let me know.
Great.
All right. Thank you for
doing
organizing this.
Thank you all so very much.
Bye-bye.
All right.
Bye-bye.
Bye-bye.